Well, hi everyone. Thank you for joining us. My name is Rebecca Root, and I am a reporter and senior associate with Devex. And if you missed it, yesterday in a session, MSD for Mothers launched a new initiative called Strengthen Systems for Safer Childbirth. And the clue's in the name, but really the idea behind it is to put local actors in the driver's seat when it comes to supporting the implementation of multi-sectoral solutions that are really going to reduce maternal mortality. Because even though it's quite possibly astounding, in 2021, every day, 800 women still die from preventable causes related to childbirth and pregnancy. This new initiative is really going to try and tackle that by funding and mobilizing a coalition that will work to implement a variety of solutions across the board. And so here today with me, I have three guests, and we are going to talk about this new initiative and what its potential impact might be. So first up, I'd like to turn to Temie Giwa-Tubosun, CEO at LifeBank, which is a platform that delivers medical supplies to hospitals in Nigeria and in Kenya. So Temie, first of all, in your view, is this an initiative that's needed?
Absolutely. This is timely. It's an initiative that is very, very much needed. Local actors and people on the front line at the last mile are absolutely critical. They understand the problem. They live it every day. We do the work often, and it's important to get our voices in on the table to start having conversations about how to solve the problem once and for all. It is a large problem, and I think a coalition of all the actors together, I think is the chance that the world will finally move towards ending maternal mortality once and for all.
Great, thank you for sharing your thoughts. And what difference do you think it will make to the patients themselves having local actors in the driver's seat when it comes to these maternal solutions?
I think it will make a lot of difference to the patients. I think the patients have quite an intimacy with these local actors. For example, every day about 830 women die of maternal death, and about 98% of this death could be averted. And every single mother that we're talking about that is in the statistics is an actual person that have their stories. They care, they matter in their community, they matter to the lives of their children, to the survival of their children, to the survival of their community. And I think that this particular, each story of these women who die across the world, I think is known by the local actors. We know their names. For us at LifeBank, every mother that we rescue, we get their first name and we know their name, and we're very familiar with their stories. And I think by advocating on their behalf, and coming together and coming up with solutions, right? For us, our solution, the solution we've come up with, is building a supply chain to get all critical resources from uterotonics to vaccines to blood into the hands of the caregiver, right? And by doing this work, the only way we were able to discover this work is because we're on the ground. We're doing the work on the ground, and we have such intimacy with the patients. And if we're able to save their lives, if we're able to build a system that will save their lives, I think it will really matter to them, to their families, and to their countries and their communities.
Mhm. Yeah, absolutely. But historically, when you've been doing the work that you do, what have been those big barriers or challenges that you've faced? And how do you see an initiative like Strengthen Systems for Safer Childbirth coming in to help break some of those down?
Right. I think that you can only fund what you view, right? What you can see, right? And I think when we look at public health, global health generally, and the way we sort of like apply resources to certain problems and to certain solvers, right? Certain innovators, right? And I think the way we sort of like apply resources is based on what we know, right? It's based on people who have access to offices, people who have access directly to people with power. By breaking down those barriers, by prioritizing the voices of people at the last mile, by prioritizing the voices and the work, right? So it's not just voices, right? We're not here to just talk, right? We're here to rescue women and to do the work. By prioritizing the work that people at the last mile are doing, I think we have a big chance to solve that problem once and for all. And by prioritizing their work, resources will follow that, right? And I think this is the one chance we have once and for all to sustainably, right, to sustainably solve this problem. For us, that is very key, and I think this plan, this new strategy, this new opportunity that is being, you know, empowered by Merck for mothers, I think has a very great chance of solving and reducing maternal mortality significantly.
Great, Temie. Thanks so much for weighing in. Next up, Craig Kennedy, I want to come to you. You're Senior Vice President of Supply Chain Management at Merck. And we've just talked there from a local perspective. I want to ask you where you see this initiative fitting in at that broader, wider health system level.
Yeah, thanks, Rebecca. And thanks very much for having me on the conversation today. So, it's very important to note, as Temie said, that it takes a multi-function system to deliver quality care to people. And many of those functions are served by the private sector, many of them by the public sector. So getting essential commodities to that last mile, essentially to the patient, has been a long-standing challenge, particularly in the low and middle income settings. And this is a challenge the private sector have responded to over the years. There are plenty of examples, including third-party logistics providers. So across the healthcare system, private organizations are also playing a critical role in areas such as data and information management, which is essential to ensure responsive operations and ultimately to address the needs of the healthcare user. So this initiative really gives us a chance to integrate all of the parts of the healthcare system in a way that actually brings the quality care to the patient that they need.
And so, do you see local private sector actors really contributing to that overall function of the system?
Yes, absolutely. There are plenty of examples even out there today. And in fact, I would say it's essential for that to be the case for the future. We take for granted often what the last mile takes to get quality care to a patient. And we don't necessarily see all the players that are in the system today that really are doing that for patients as it is already. So an initiative like this really is aimed at making sure all of those pieces can play together, and specifically those places where private sector has the capability but isn't necessarily as well aligned or well scaled to be able to meet the challenges that actually do exist. It's essential to make this work.
Great, thank you. And then thinking about the types of investment opportunities that are going to come through this initiative, what difference do you see those making to companies who are really looking to get products to the last mile?
So, the investment opportunities that are being made available really help them to organize and scale, really get their processes and systems up to a place where they can actually serve the large quantity of patients which are out there. So the access to these kinds of investments are essential for a small, medium, private sector companies to be able to take the services that they do really well, to do the integration in a way that is actually efficient, and to be able to do it at scale in a reliable fashion. So this is really a supercharging of their abilities.
Great. And what would your message be to the maternal health community in general? How can they support this initiative, take part, get involved?
So the MSD for Mothers team and the partners that we have under the Strengthening Health Systems for Safer Childbirth are seeking expressions of interest right now from organizations with roots in sub-Saharan Africa or Southeast Asia that will work in coalition with local partners across sectors, government, private and or even civil society to implement and evaluate evidence-informed solutions that will result in a measurable and sustainable reduction in maternal deaths, and therefore, by extension, stillbirths and newborn deaths in specific geographic areas. So, what I would say is take advantage of those expressions of interest now and really lean into the fact that it takes a whole system to make this work for patients. And this is the opportunity to get your part contributed now.
Great. Thank you so much. And finally, Lesley Bearman Lahm, I'm coming to you. You're the Asia Development Bank's representative in the North American office, and ADB is one of the partners collaborating with MSD for Mothers on this initiative. Can you tell us why ADB felt that this was really an important move to make?
Yeah, certainly. Thank you, Rebecca. I think from our perspective, what we're excited about is the interest and the emphasis on the providing private sector solutions in the healthcare, maternal healthcare area. I think we all understand the gaps that exist, and ADB feels very strongly we are pivoting much more in our strategy 2030 towards providing private sector solutions to these market gaps. And we have a unique ability to work with governments. And in many ways, these initiatives depend on a partnership between the government and the private sector. And we're really looking forward to working with MSD for Mothers to find innovative solutions to not only identify, but also implement private sector solutions that will incentivize innovators and private sector providers to come to the market and help the government in providing these maternal health care services to our citizens.
Great, thank you. And one thing that we do know is that there is a massive financial gap when it comes to maternal care. How do you see this initiative really helping in the geographies where ADB works?
Yeah, that's always the issue, right? These are when you look at a multilateral development bank and what we bring to the table, we're not just bringing financing. We can't operate, and we're not authorized basically to operate in markets where markets are functioning, where money is available. So our role is to bring additionality. So our role is to bring to the market financing that's not currently available on terms that may not be available, typically longer term financing, and provide a demonstration effect to the private sector that these are sustainable investments that have, commercial viability. And as we know, the commercial viability of these types of investments correlate to development outcomes. So it's really, the word is mobilization. The governments can't do it themselves. We can help them create fiscal space to have more money to apply towards healthcare. The private sector can't do it itself. So I think it's really a partnership between governments, private sector, and the MDBs, that together we each bring something unique to the table that in turn mobilizes finance. And that really is the key, is, how do we get enough finance into these markets? And that really I hate to say it, but mobilization is the key, and that's really where we have a strong impact.
And obviously, this is a partnership, and you mentioned partnerships there. What do you see as being the key to a successful partnership, and how do you plan on implementing this when it comes to this particular initiative?
Yeah, it's really a question of focusing on the areas of core expertise. So what we would see as an optimal universe is a government would focus on access to healthcare, universal healthcare, putting in place the regulations that make it possible for the private sector to come and invest. And then the private sector, comes in and works on expanding facilities that are there then for people to have the access to the services that they need. A recent investment we did was in Indonesia in a maternal health care hospital, and that was very successful. We put in, I guess it was about 19 million in equity, and that has resulted in the ability of people the underserved, who typically can't pay for care, to come and get services at that hospital, but also the private provider gets paid for providing those services. So it's really a win-win situation when you develop a structure of that nature.
Great, thank you. And I just want to quickly do a whip around and come to each of you and ask your key takeaway, key message when it comes to really accelerating progress in the maternal health space. Temie, we'll come to you first. Sorry, I know I put you on the spot there.
Absolutely. I think that something that is really key to accelerate progress is what MSD for Mothers is trying to do by powering local voices, local innovators that are solving all the critical challenges, by building the right supply chain that will get the critical blood and nutrients to the hospitals, and by ensuring that the global health, the global health community can hear the voices of the last mile, of the people who are doing the work at that last mile. I think all of this together will give us a chance to solve maternal mortality once and for all. Thank you.
Thank you. And Craig, coming to you.
Yeah, thanks, Rebecca. I would just say no one player can solve this issue by themselves. It requires a multi-system approach, and it requires partnerships between all of the players in the system. So let's lean into the opportunity that's being created here with the partners under this initiative now, and try to make a materially positive movement for the world.
Thank you. And Lesley?
Thanks. Picking up on the idea of partnerships, I would echo that and say let each partner focus on their core area of expertise and provide incentives for them to do so. And from our perspective, obviously, that's the government to set the targets, what their maternal mortality targets are and how they want to achieve their targets, and then provide the private sector with the opportunities in the space to come in and invest in the facilities and the services delivery and the innovation and the standards necessary to deliver those services and meet those targets.
Great. Well, thank you all so much for joining us today and for sharing your thoughts on the initiative and its potential impact. And thank you all very much at home for watching.
Thank you.
Thank you.